I was surprised when I first heard the news, but I think it's brilliant actually, because obviously dentists are medically trained, and we all know that vaccines don't save lives. Vaccinations save lives. So the idea of trying to improve access as much as possible and get people vaccines administered is really important. Now, of course, we have to be careful that the dentists that are administering these vaccines are properly trained and are also told about the side effects that they need to monitor for. But if that's done correctly, I'm in full support of the idea.
In terms of essentially multiplying the healthcare force that can give those vaccines, is that what that does?
That's exactly what it does. And, unfortunately, we don't want to create a bottleneck. We already have bottlenecks with vaccine manufacturing, vaccine distribution. And the last thing we want to do is create a bottleneck with vaccine administration. So if you feel like someone who is medically trained, has a background in medicine, can monitor for some of those adverse reactions, can administer those vaccines, recruiting them into your administration team, I think makes a lot of sense. And I'm really hoping that it does help the uptake of the vaccine so that we can get them into those arms as quickly as possible.
Is there any risk or risk benefit kind of scenario when you look at dentists? I know even in our newsroom, they were kind of surprised. They're like, "Oh no, a dentist giving me a shot." Any risks
Yeah,
there?
there is, and of course, even we think about vaccinations being given in grocery stores, it's the same sort of thought pattern that goes into our heads. But essentially, a dentist's office is not a medical office. And so, number one, you have to make sure, like I said, that they're trained about the right things to watch out for, the right way to administer the vaccines. Number two, you have to make sure that they have the necessary equipment. For example, if somebody were to have a severe anaphylactic type of allergic reaction to the vaccine, they should be able to have some of that resuscitation equipment to try to stabilize the patient until, EMS or 911 can arrive. So those two are, I think, of course, very, very important, that they're doing it correctly, that they're trained to monitor the side effects, and that they know how to treat those side effects if they were to occur in an emergency.
Yeah, and I think my understanding at this point is that the plan is to have the dentists available at like mass vaccination sites rather than individual clinics, at least initially. But obviously, I think the turn for this could be that maybe in the long term that they could provide these vaccines at their individual offices and clinics, maybe even flu vaccines and other inoculations just to help, with other things. But obviously, the focus right now is on COVID and trying to figure out how to get those vaccines out as quick as possible.
And if you're having them in a tent, a medical tent, where you've got people who can resuscitate patients, then that risk goes down even more, because then you do have a lot of those resources collectively. And obviously, dentists are used to administering injections and things like that, so they do have the experience to do that. But I will say that, in my opinion, the bottleneck does not appear to be the administration, but the bottleneck really does appear to be the manufacturing and distribution. And there's been a lot of discussion about using half-dose vaccines or doing just the first dose and not giving people the second dose. And, all of those are suboptimal. What we really need to be working on, the bottleneck that we're facing the most right now, is that manufacturing and distribution. So I think I wish that more governments would focus their efforts in really trying to ramp that up, because we knew this was coming. This was not something that caught us by surprise. We knew the vaccine was coming. So I really wish that we had been better prepared to ramp up that manufacturing.
Absolutely. Yeah, it could. The faster we can get it out, the faster we can get it in people's arms and getting away from this pandemic.
Exactly right. That's exactly right. Especially now that we're faced with a more, aggressive opponent with some of those mutant strains out there that are spreading more quickly. I think the vaccination really does need to occur much more quickly to keep pace with that.
Anything else, Dr. Coley?
No, I think that's it. It's kind of an interesting concept. I will agree with you. I was surprised when you sent me that email because I hadn't really thought about it. But I will just add that it does say, that CDC does say that in emergency situations, dentists, and in fact, all medical providers, are really given the authority to sort of practice outside the scope of their normal practice, which is exactly what is going on here. So
yeah, I mean, in many cases, we don't think about it, but doctors give shots pretty regularly. Lidocaine, obviously, it's not a vaccine, but but they're trained to administer those. Obviously, like you said, there is some of that equipment issue that they may not have readily available to them, like
or be trained on how to use it, because you don't often get cardiac arrest or those types of things occurring in a dentist's office, and dentists don't really give vaccines in the normal scope of their work. So it is important to teach them how to administer the vaccine correctly, how to draw it up. That's another piece of it that I find is very critical, because a lot of the vaccines, for example, the Pfizer vaccine, need to be reconstituted. So if that's not done correctly, or the person that's drawing it up is not trained correctly, you could obviously substantially alter the results as well, of what happens.
Yeah, and I know equipment would be an issue as well, especially when you're talking about the Pfizer vaccine that has to be stored at those, super cold temperatures. So, it seems like off-site will probably be the initial round of, use for dentists as that begins to occur. But when we get into those, office to office vaccinations, that'll be definitely a huge concern, and something that we'll have to take precautions for.
And we have to be careful, because it's a slippery slope. So it's one thing to have an RN do it, or a doctor do it, or a dentist do it. But if you start thinking about dental assistants, medical assistants, that's when you could start to get into trouble, because those are not normally the people that administer necessarily the vaccines in the office. So we do have to be careful that we're not going too far beyond the scope of what people normally do. If you're doing it at the highest level of training, it may be acceptable to slide a little out of the lines. But if it's someone who, just fresh out of dental assistant school, or is a dental hygienist, it may not be reasonable for them to practice outside the scope of their practice.